Okay, so today's topic of conversation, I want to talk a little bit about downsizing. So if you remember bell bottoms in the 70s, and then now or it could be already going back to slim fit. We talked about wide going into much narrower. These trends are very popular even in surgery. And so if you remember, Pamela Anderson and Dolly Parton kind of set the map for very large breasts in the 1980s and such. Well, nowadays, the most common procedure, which I'm doing today, right now, is downsizing. I have a lot of patients coming in, and they've had their breast implants for a very long time, 10, 20 years, and they're just kind of tired of the weight, the heaviness, not fitting into clothes, and things of that nature. So downsizing is one of the most common procedures that I do. Now, when we're downsizing, we have to do a couple different things. We're obviously going to remove the old implant that's way too big. And then I have patients that sometimes will go to a smaller implant, which will entail doing a full remodel of the breast, both in the inner lining, that's the internal bra lift, as well as a T-lift on the outside. This patient is actually done with her implants altogether. So what we're gonna do is, step one, remove the implant. Step two, we're gonna do the outside lift, but on top of that, I'm gonna use this central element, and we call that the auto augmentation, where I'm going to move this element of tissue and push it up into her cleavage so we can maintain some cleavage since we're removing the implant. Benefits, let's go to 10, are you're gonna just be my goal generally, even if it's a new patient or a revision, is I want the patient to feel comfortable, right? And so that comfort is being proportional. Not a fan of going too large, not a fan of going too small. But if we can fit your frame from the primary augmentation, then you'll avoid cycling. What I see a lot of is going too small, then big, then bigger, then downsizing, and going into that vicious cycle. So once again, pick your implant size with proportionality so that you can be proportional, and that way you'll have a long-lasting result.